My name's Dr. Nicholas Meyer. I'm a practicing dentist of 40 plus years in Scottsdale, Arizona. 3 years ago this month I came out with this book. It's called The Holistic Dental Matrix, How Your Teeth Can Control Your Health and Well-Being. And really what it is, it's a self-help book for a lay population or doctors that may not know and want to find out more about what the interrelationships of the mouth are with respect to total body health and well-being. So that said, it's broken down in a whole number of different chapters, and heavy metals are one, fluoride toxicities, the mercury issues, the problems with root canal treatments, the area of commonly called cavitations or jawbone lesions or ischemic bone disease, Nico lesions. There's a whole lot of names that are ascribed to particular things. And so when we look at these, and I just use these terms kind of, they're just rolling off my tongue, but really what we're dealing with are toxicities in the body. Root canal toxins, the types of toxins that are emanated from the bacteria that are housed inside the tooth that are in a root canal tooth, or the bacteria, which they all are loaded with lots of bacteria, are what I mentioned, cavitations. Cavitations are, for lack of a better description, a hole in the bone. Sometimes it is a physical hole in the bone, other times it's kind of like a false hole, and there's an area of disease that is housed in the jaw, mandible or maxilla, and inside of that it's predominantly a staph infection that we find because we do a lot of testing, and we're finding that these are loaded with mixed organisms, usually upwards of 15 and 20 typically in one of these lesions. And so people come and they find me for these treatment of these problems because they're not widely known in the field, and I've been doing these surgeries for now over 20 years. So my batting average is quite good in helping people overcome some serious health challenges at times. One that comes to mind was a medical doctor who had been in hospice 5 times, ended up doing some surgery for him in one area that five or 8 different dentists said was just fine. I said, look, this is not fine. This bone is pathological. So we did a procedure for him. His heart rate normalized. He was able to get up, walk outside. He wasn't have to stay out of the sun any longer. His story is my poster child in my book, in the chapter on these jawbone lesions. It's quite a heartwarming story. And these are the types of stories, though, that I regularly hear. So my role in dentistry isn't so much just fixing teeth, although I do that quite well. It's more on the medical side of things. So I look at my role in dentistry as a medical practice wrapped in a veneer of dentistry. Because yes, I am a dentist, but I've been schooled and educated well in the area of alternative medicine, complementary medicine, normal medicine, energy medicine, and I use many tools from those various disciplines in my practice. So we use microcurrent lasers of different types. We use vitamin C IV during our surgical procedures, or having somebody's mercury amalgams removed. We'll have a high dose vitamin C during that time period of the extraction process, and then whatever's left in their bag through the completion of it. With a caveat, they have follow-up care with a qualified individual to manage on the medical side, the heavy metal detoxification that we know is in their body from having all kinds of stuff for many years. Let's face it, the most common filling material for over 100 years was mercury fillings, with which almost 50% of that was mercury. And it was not, it was found to be not what I was taught in dental school back in the late 70s, that once it's mixed together in the filling material, it's locked in there and nothing happens. Well, that was debunked decades ago. And So anyway, it does leave, it does travel, it goes through the blood-brain barrier, it travels from mother to baby. So even if the kids that we see today don't have mercury fillings hardly at all in their teeth, they could still have heavy metal toxicity because they grew up with a mom while they were being in utero that had a mouthful of mercury fillings, and that just traveled right into the baby as a sink, a mercury sink. So sorry to say, but these are the kind of challenges that are out there that we see. Got a fairly good working knowledge of the types of things that need to be done for those kind of people to help them recapture their health, and which is validated the term that we used here, how your teeth can control your health and well-being.